Thanks for joining in for today's webinar answering your questions about applied behavior analysis. We have a few announcements before we get started. The Johnson Center hosts several free webinars throughout the year, and we will soon be announcing the fall schedule. These will be posted on our website by going to www.johnson-center.org, then clicking on the webinars link on the right-hand side. You can also join our email list there and stay up to date on all events and opportunities by clicking on the Join Our Email List link on the homepage. We also post news to our Facebook, Instagram, and Twitter accounts, and these are great sites to stay up to date on news like scholarships, research news and opportunities, events, and more. Also be sure to check out our library of past presentations on our YouTube channel at youtube.com/The Johnson Center. And be sure to follow our colleagues at the Autism Research Institute as they also host several great webinars and share some great resources on their website and social media pages. We currently have some terrific family support programs here at the Johnson Center, including grants and sliding fee scales for diagnostic services, counseling support, sibling camps, and more. There is still a couple of spots available in our last sibling camp of the summer coming up on August 5th. If you'd like more information, please contact us at info@johnson-center.org. If you would like a certificate of attendance after today's webinar, look for a follow-up email in your mailbox 1 hour after the webinar concludes, or look for the link on our YouTube channel in the webinar description. It will contain instructions on how to get your certificate. If you have questions during the live webinar, please type them into your GoToWebinar control panel or email info@johnson-center.org. If you are watching a recording of this webinar, you may email questions to the presenter at info@johnson-center.org. Today's webinar is presented by Amanda Tami. Amanda has a master's degree in counseling psychology and completed a recertification program in applied behavior analysis. In addition to being a board-certified behavior analyst, Amanda is also a licensed professional counselor. She has extensive experience working with both children and adults, including those who have autism spectrum and other pervasive developmental disorders, ADD, ADHD, anxiety issues, and trauma, both as a BCBA and as a counselor. She has additional specialized training as a counselor in EMDR therapy and its applications to children. Please welcome Amanda Tami as she answers your questions about ABA and autism.
Hi everyone, and thank you for being here today. We are going to answer some questions that you have sent in before the webinar, and then as you send in questions during the webinar, I will try to answer as many as I can in the next hour. Please keep in mind that this webinar is for informational purposes only. I'm not able to offer any advice or recommendations about case-specific questions, either during this webinar or through email afterward. So please consult a local healthcare provider or contact the Johnson Center for to schedule an appointment for any case-specific questions. I also want to mention before we get started that the Johnson Center's YouTube channel has all of our past webinars, recordings of our past webinars available to you to watch at any time. And we do have a webinar that I did earlier this year called ABA Basics, Principles, Terminology, and How It Works, that will give you basic information about what ABA is, how it works, what you should expect if you're new to ABA. So that could be a good resource for you as well for any general questions about what ABA is. Okay, let's get to some of the questions. I have some, like I said, that were sent to me previously, so I'll start with those, and then hopefully we'll have time to get to all or most of the questions that you continue to send in. So some of the questions that I have already received and probably that I will receive during this webinar are pretty case specific. And so, like I said, I can't offer any clinical recommendations or any advice about the specific case, but I can tell you about how ABA would apply to such a situation, and hopefully you can take that information and apply it to your case or take it to a professional who you're working with. Also, some of the questions are pretty long, so I will do my best to summarize them. So the first question is about someone's child who is 6 years old, diagnosed with autism at 2, and has been doing ABA, speech, OT, and physical therapy. He had been toilet trained and had no problems using the toilet, no problems urinating for a long time. And then an issue happened where his genitals were swollen while he was at ABA, and after that refused to urinate at the ABA center. At home and in other bathrooms, there were no problems, but at ABA, he would not urinate there anymore, or he wouldn't use the toilet anymore. He, from what I'm understanding, he was not having accidents there. He was just not urinating at all while he was there. And this person says that the ABA center is trying to pair using the toilet there with reinforcement, with so kind of retraining him to use the toilet, from what I'm understanding, doing all of the preliminary steps of going to the toilet, taking off his pants, and working up toward using the toilet to urinate again, and trying to pair all of those steps with reinforcement. And so parent is asking, what can they do to address this problem? So first of all, again, without knowing all of the specific details, I can't offer any specific recommendations, but it sounds like what the ABA clinic is doing is taking the right steps. That is what I would recommend starting first, to pair using the bathroom with reinforcement, make the bathroom a positive experience. It is possible that the issue that he had with his genitals while he was there was really scary for him, especially if it was something that was painful. I don't know what the issue was, but if it was painful, it could be that is really scary. And so now he's afraid to use the bathroom when he's there, fearing that something like that's going to happen again. So trying to make the bathroom a really fun and positive place rather than a scary place is a great first step. Rechaining all of those bathroom behaviors. Chaining refers to a behavior chain is a series of behaviors that go together to that you would need to do to complete a task. So, for example, tying your shoes or brushing your teeth, all of those behaviors are actually several behaviors put together to complete this task. And so toileting is similar in that it's a series of behaviors that need to happen to complete the toileting task. And so re-teaching that behavior chain with reinforcement at each step is a great place, is a great place where they're starting at his ABA clinic. So I would agree with that. Now, I would question whether this is, because he's not having accidents, he's able to hold it for several hours at a time. Maybe his refusal to use the bathroom there is not a problem. Maybe it doesn't really matter. Now, if he's also refusing to eat or drink because of it, and is possibly getting dehydrated because he's not drinking, then that could be a bigger concern. But if he's just not using the bathroom when he's there, he's able to hold it until he gets home. Maybe it's not something that we need to be super worried about. Again, I'm not, I can't say for sure. It might be something you want to consult with his pediatrician about. But if there's not an accident happening, it's not creating problems because he needs to go but refuses, and so challenging behaviors are coming up, or he's refusing to do what you're asking him to do, maybe that's okay. Maybe it's okay that he's not using the bathroom when he's at the ABA clinic. Excuse me. This person also says that I believe it's when at home, this the child will purposely urinate on the carpet or toys. Parents get very angry when this happens, and a child is very excited, laughs, seems proud of himself for doing it. So I would suggest that if you haven't already done this, that you let your ABA clinic know about this, know that this is what's happening at home, because your ABA provider could perform what's called a functional behavior assessment at home, at your home, when this happens, to help to just determine what is the function of this behavior. And so what the question says is that the parents get angry when he does this, and I would imagine express that anger or interact with the child in a way that shows that they're angry. And so it may be that this behavior is the function is attention, in which case, by getting angry and having that reaction and interacting with him when he does that, you're actually reinforcing the behavior. Now, it may not be that attention is the function. So I would highly recommend that your ABA provider do an FBA to help to determine what the function is, and that will help them to help you. That will help them to teach you an intervention for what to do when that happens and how to prevent it from happening in the first place, that addresses the function and is more likely to be an effective intervention. And also, he likes to put his toothbrush, toothpaste, and other toys in the toilet. He knows it's not right, but he keeps doing it. He doesn't think the toilet's dirty. He likes water play. He even sometimes plays in the toilet water. So, again, we would want to think about what is the function of the behavior, and we can change the behavior most effectively if we use an intervention that addresses the function. Now, it is very normal for kids to like to play in the water, and often young kids don't understand that toilet water is dirty. Thank you. They don't understand that they don't understand why they're not supposed to play in the toilet. So you may just need to take some steps to give him the ability to play in water, to water play in other places while restricting access to the toilet. So you might put a bowl of water outside the bathroom door, for example. He can play in that bowl of water all he wants, but he's not allowed to play in the bathroom anymore. It may be that you get the child locks that go over the toilet seat that make it harder to lift the toilet seat up, so that when he's in there brushing his teeth, he's not able to put the toys in, or the toothbrush and other stuff in the toilet. But I would highly recommend that if you do that, if you do try to limit access to the toilet or make it harder to open, that you do allow water play and give him the tools to play in water elsewhere, like a bowl or something like that, because it's clear that he likes water play. So let's not take that away from him. Let's keep giving him the opportunity to play in the water, since that is something that he likes and is reinforcing to him. Okay, my next question says, I have a 58-year-old autistic son who also has Parkinson's and quite frequently wakes up in the morning with a chip on his shoulder. We give him medication, sleep aids, but they've not been effective, including naturopathic suggestions like melatonin. We've tried some drugs that were not effective. Is there any other way that we might be able to control or prevent it? And maybe a lack of sleep. So again, I can't say for sure what's going on in this case, and I don't know exactly what this person means by the person waking up with a chip on his shoulder, but I will do my best to give you some suggestions and some ideas, and hopefully some of this will be helpful to you. So first, I can't speak about medication or naturopathic sleep aids. I can't talk about any of that because that is not my area of expertise. But I can tell you that, again, on the Johnson Center's YouTube channel, We have all of our old webinars available for you to watch at any time. And the Johnson Center does have several webinars on sleep. One of them is from our nutritionist, so that may have some information about supplements and other possible sleep aids. We also have one from our psychologist more recently that talks about some of the behavioral issues and sleep anxiety and stuff like that. So those might be good places to get some more information. From a behavioral perspective, I would first recommend that you think about this person's, so let me back up. If we are suspecting that this behavior, this person's morning behavior is due to a lack of sleep or poor quality sleep, in addition to speaking to your doctor about what could possibly be causing insomnia or poor quality sleep, I would first suggest that you think about this person's sleep hygiene. Sleep hygiene refers to all of the behaviors that a person does around their bedtime, throughout the night, how their environment throughout the night. And sleep hygiene can have a really big effect on how well a person sleeps and how quickly they can fall asleep, the quality of their sleep. And so good sleep hygiene habits would include things like having a consistent bedtime and wake up time every day, limiting screen time to turning off any screens at least 1 hour before bedtime, having a very dark and quiet room, or if it's not going to be quiet, it should be a white noise or a constant noise, so that, and sometimes having a white noise machine or something like that can help to block out the sounds of things happening in the rest of the house. So if you're not going to have silence, white noise is a great alternative. Limiting caffeine, limiting before bedtime, limiting food and drink before bedtime. And I believe Dr. Rundle, who did the more recent sleep webinar that's available on YouTube, goes into a lot of that information about sleep hygiene. So from a behavioral perspective, I would say start there, which would hopefully help to improve the quality or the amount of sleep that the person is getting. Beyond that, if it turns out that that is not the problem, or that the problem persists despite quality sleep, there are things that you can do. There are behavioral ways that you can intervene to help to change that person's morning behavior. So again, I don't know exactly what the behaviors are that we're talking about here, what the behaviors are that this person describes as waking up with a chip on his shoulder. I would guess it's things like maybe yelling, possibly physically aggressive behavior, possibly name calling or saying mean things, or I don't know, demanding or making requests that are demanding or something like that. I don't know exactly what this person means, but whatever it is, however this person is behaving, that this person describes as having a chip on his shoulder, I would recommend that you sit down and write down exactly what those behaviors are that the person is doing that make mornings seem, really difficult, or it makes it seem like he's really grumpy in the morning. Whatever that is, write it down and very specifically describe what those behaviors are. And then think about, so whatever those behaviors are, remember that they are this person's way of communicating. This person is getting something out of doing those behaviors, getting some sort of need met. So how can you meet that need? Let's not take away whatever he's getting from it. How can we make sure that he gets that need met, but in a different way? So if it's, he's very mean about the way he asks for breakfast. He says it in an unkind way. We don't want to take away his breakfast, certainly, but you can tell him, I hear that you need breakfast. I need you to say, please make my breakfast. Or I need you to say, I would like eggs, please. Tell him what you want him to do instead. So instead of whatever it is that he's waking up with, however, whatever these behaviors are that are making mornings more difficult, what is it that you want him to be doing instead of those behaviors? And without taking away whatever he's getting out of it. Now, this is certainly going to take some time. You know, if we go back to the breakfast example, maybe tomorrow you say, I need you to say, can I have eggs, please? And hopefully he says it and you get him the eggs, and maybe the next day he'll remember that and do it again. But it's more likely that you're going to have to prompt him and then reinforce that new response that you want over and over and over again before he starts to use that new response independently. And so it is going to take time. It does take a lot of work, but he will learn over time that, okay, saying, I need eggs doesn't work anymore. I don't get eggs when I do that. But when I say, can I have eggs, please? I do get eggs. And so I'm going to do that instead. It will take time, but he will learn that. So I hope that some of that is helpful. The next question says, I'm going to summarize this. The child has social anxiety, ADHD, and Asperger's. He's in an ABA program at school that rewards him with free time at the end of the day. But he is not really able to do some of the things that they're asking him to do that would allow him to earn free time. For example, asking for help, initiating conversation, asking to leave the classroom when he's upset. So, excuse me, as a result, at the end of the day, he's getting less free time than the other kids are, which is upsetting, making him dislike going to school. They think that this will help to motivate him to overcome his issues, but mom or dad, I'm not sure who, says it's not motivating him. It's making him angry and more anxious. For the last 2 years, it's made things worse. We have discussed our concerns with the team repeatedly, but they continue with this approach, and then asks, how is ABA supposed to work? So I would agree with you that if that is in fact the outcome, that he's not earning his free time at the end of the day, that something's not working. Excuse me again. So whenever we are using an ABA intervention, the idea in ABA is always that our decision making and any interventions that we use should be data driven. So I would hope that the school is taking some data on his behaviors. So I would highly recommend that you ask the school to see the data. And if the data is showing that, number one, these target behaviors that they're looking for, like asking for help, initiating conversation, asking to leave the classroom when he's upset, if he's not making improvements in those areas, then the intervention isn't working and we need to change something. Likewise, if they have any data to show how much free time he's earning, which I hope that they would, if it is showing that he's not getting, the amount of free time he's getting is not increasing, that's also an indication that the intervention is not working. And so again, we need to change something. If the intervention is not working, there's a problem with the intervention. It's not that the child is unmotivated. The problem is the intervention is not working. So we need to change the intervention. And I think that if you can access the data and see that and point out to the school, even your data shows that we're not seeing improvements in the behaviors that we're targeting, and he's not earning the free time, he's not accessing the reinforcement. Those are both really big problems, and I hope that if they have an understanding of ABA, that will be the indication to them. Although if that's what the data shows, I would hope they would already know that. It's kind of concerning that they aren't seeing that if that's the case. So I would definitely point out that data to them. Now, ABA, the goal of ABA is skill development. We're always looking for skills that a person doesn't have and finding ways to teach them those skills. When we're teaching a skill, we need to make sure that that person has any more basic foundational skills that they would need in order to be successful in these more complex skills. So if we're thinking about, for example, doing math, if someone is struggling with basic two-number multiplication, they're certainly not going to be able to do, more to do algebra, or they're not going to be able to do polynomials. If they can't do basic multiplication, they're not going to be successful in more complex math. So if someone's really struggling in math, we wouldn't necessarily just keep teaching them the same thing. We might need to go back and teach them those more basic foundational skills so that they can be successful. And the same is true for any skills that we're talking about. So in this case, asking for help, initiating conversations, asking to leave the classroom when he's upset. Certainly it is possible that this student isn't doing those things because he's not able to get enough reinforcement by having a break at the end of the day or having free time at the end of the day, so he's not motivated to do it. But it's also absolutely possible that what we're asking him to do is beyond what he's able to do, that he is not able to ask for help for some reason. He doesn't have some of the more basic foundational skills that would need to happen in order for him to be able to ask for help. For example, he is not able to identify when he needs help. If he doesn't know when he needs help, he's not going to ask for help. If he doesn't have the language or have some communication system that works for him in place that would allow him to ask for help, he's not going to be asking for help. If he has some anxiety and is too scared to ask for help, he's not going to ask for help. So certainly, if the suspicion is that motivation is the only problem, then maybe the school would need to consider using something different for reinforcement, or making access to the reinforcement easier. So maybe he doesn't have to wait until the end of the day, but a shorter period to get that. And that absolutely could be the case. But we also need to consider that he's not doing these behaviors because he's not able to. He doesn't have the skills to do them. So I would suggest both. Certainly start with the data at school. What does the data show? And go from there in terms of either finding a different way to get him reinforcement and or possibly both, identifying more prerequisite foundational skills to those things that they're asking him to do. Okay, can a parent be a therapist on their child's team? So generally not. Usually a parent could not be a therapist on their child's team, assuming that we're talking about an ABA team that's overseen by a BCBA, because for one thing, that would constitute a dual relationship where the parent is both the parent to the child and would be employed by the ABA provider. And so that would, thank you, that would create a dual relationship, which is unethical for a BCBA to have to work with a parent both as their employee and the parent of their client. But also, parents play, of course, a very, very vital role in their child's ABA, and parents should be getting parent training from their ABA provider and should be learning how to sort of be an ABA therapist, or not a therapist, but be able to use ABA interventions with their child outside of ABA. That's how, or outside of ABA sessions. That is how skills are generalized. That's how, a child learns to do the same things at an ABA clinic and at home and in the community. So it's very important that parents get that training and get that information and understand the principles of behavior so that they can use the same interventions at home. But also, parents can't really be ABA therapists for their child, because an ABA therapist is someone who is outside of the family, is outside of the parent-child relationship, and is therefore able to be more objective. They can see things in a different way, or see things that parents aren't seeing, or see them in a different way than the parents see them. And so if a parent is acting as the ABA therapist, we're taking away that opportunity for the outside observer perspective. Now, it is possible that, if a family is not able to afford ABA, which is can be incredibly expensive, it can be that a BCBA can create a behavior program, teach the parent to implement it, and then the parent is the one, doing ABA with their child. But the parent could not be employed by the BCBA or by the ABA organization. Next question is, how old is too old for ABA? So technically there is no answer to this question. There is no too old for ABA. You would finish ABA once you have met all your ABA goals. You are able to do all of the goals that we set out to teach. You have shown that you have generalized the skills, and now you're finished. You are finished with ABA because you met all your therapy goals, which is the same for any type of therapy that we're doing. If you were going to physical therapy, you would finish with physical therapy once you met the goals set out at the beginning of therapy. An ABA, while it's most commonly used for people with autism, it could be applied to anyone for any behavior. So you could, if someone wants to start going to the gym more often, or live a healthier lifestyle, you could go to ABA and they could teach you, they could use ABA interventions to help you reach that goal. So there is technically no too old for ABA, but many of the ABA providers who are out there have age caps. So they might only see kids up until they're 10 years old, or some even young. They only see kids until they go to first grade. So the principles of ABA could be used for anyone, for any age, for whatever goal we're working toward. The problem could be finding a provider who would be willing to work with someone who is a teenager or who is an adult. Funding sources can also be problematic in this area. I know a lot of insurance companies in Texas require that the person be diagnosed with autism before the age of 10, I believe, in order for them to qualify for ABA. So if the person is 13 when they get their diagnosis, insurance doesn't have to pay for ABA for that person. So funding sources can also be challenges to helping someone who is older or even older than 10 access services. My child cries all the time at his ABA clinic. Is that bad? Without more information, I can't say yes or no, but I would. ABA is not supposed to be hard work. It's not supposed to be a chore. It's supposed to be fun and engaging, and it's supposed to be very, very reinforcing for the child. The child should be accessing lots of reinforcement while they're at ABA or while they're at therapy. So if the child is crying for the whole time that he's at his ABA clinic, I would wonder if it is fun for him, if it is engaging for him, if he's getting enough reinforcement. And if not, that I would be concerned about that, because it definitely should be fun. If he cries every day when you drop him off and then is okay once you're gone, that's normal. That's normal child behavior. But if he's crying for the full 4, 6, 8 hours that he's there every day, that could be a red flag that it's not the right ABA environment for him. It's not fun. It's not, for whatever reason, he hates it there. And if he is really unhappy there, he's probably not in a place where he's able to learn very effectively. What qualifications are needed to be an ABA therapist? So, to be an ABA therapist, you can be an ABA therapist without any specific qualifications. However, there is a credential through the Behavior Analyst Certification Board called Registered Behavior Technician that more and more ABA providers are requiring of their ABA therapists, or ABA technicians as they're sometimes called. And insurance companies are also requiring that ABA therapists have this registered behavior technician credential in order to allow them to work with their clients. The RBT, or registered behavior technician credential, requires coursework. So it's like 40 hours, I believe, of coursework to learn about the principles of ABA. You also have to be 18 and pass a background check, and then you have to complete a competency exam where a BCBA would observe while you demonstrate a preset set of skills that you need to demonstrate. And the BCBA would have to check them all off and say, yes, he or she can do them all. I observed them. I watched they are competent in these skills. And then you also have to take an exam. And then as an RBT, you would receive supervision from a BCBA a couple times a month minimum, that you would have to be observed by and meet with a BCBA so that the BCBA can ensure that you are properly supervised, that you are properly implementing interventions, and make sure that you are following all of the behavioral principles and ethical requirements of the board, the Behavior Analyst Board. So if you are a parent looking for someone to provide ABA for your child, I would recommend that you look for someone who does require the RBT credential. It is just, you can be assured that that person has had training in behavioral principles, is getting supervised, meeting supervision requirements from a BCBA, and has taken these steps to be credentialed by the Behavior Analyst Certification Board. It is not technically required that everyone working, that any ABA therapist is an RBT. So you might find an ABA clinic that doesn't require that their therapists be RBTs, and technically that's okay. There is no requirement, aside from through insurance, that the therapists be RBTs. But by working with someone who, BCBA, who does hire RBTs or who trains their therapists to be RBTs, you can be assured that they have more, or that they have a minimum amount of education and training, and that they are meeting supervision requirements. How is ABA used to teach a child to speak? So ABA would be used to teach a child to speak by identifying those, well, first of all, where the child is in terms of learning to speak. Do they have any vocalizations? Do they have non-word vocalizations? Are they able to use some words, but not effectively, or they have echolalia, but no, they aren't doing any spontaneous functional speech? Maybe they have some speech, but can't have conversational speech. We want to start by looking at where the child is now. I'm gonna mute myself for a second while I cough. I'm so sorry. Sorry about that. So we look at where the child is now, what are their current abilities as far as speech, and we build from there. So if the child is has echolalia, meaning they repeat what they hear other people say, but they don't have any spontaneous functional speech, so they repeat what they hear other people say, but they don't use speech to communicate their own needs or stuff like that, then maybe that's where we would want to start, by teaching them, that words mean something. So we would start pairing words with objects. Start with very physical things, like favorite toys. This is crayon, crayon, crayon. Use the word over and over. And then we reinforce it. So as soon as the child makes any sort of attempt to say that word in the presence of the crayon, we would reinforce it, even if it's just, a or kra or ka or something like that. We would give reinforcement. And in doing so, gradually the child learns that speech, or communication, whatever they're using for communication, sign language, speech, PEX cards, that communicating has value, that using language to communicate has value, meaning they get something out of it. There is something beneficial to me when I use language to communicate. So when I try to say crayon, or when I use the word crayon and then I get the crayon, I get this thing that I really, really want and I really, really like, that was valuable to me. I got this thing from it, and thank you. I got this thing that I really like from it, and so it has value. So doing this, speaking, communicating, using language, there's a reason that I should do that. I get something out of it. There's something beneficial for it to me. And so basically, to use ABA to teach a child to speak can be a very long process, as can be the process for learning any behavior. But in a nutshell, it's the same as teaching any other behavior in ABA. We look at where the child is, where are they currently performing, what's their current level, what are they able to do, what would be the next step, how can we build very gradually from here. And as we do that, we provide reinforcement. We find ways to prompt the behavior that we want. And then as soon as we have the behavior or an approximation of the behavior that we want, we give lots of reinforcement to encourage the behavior to happen again and to teach the child doing this has value. You'll get something out of doing what we're asking you to do. What is the difference between ABA and play therapy or speech therapy? Well, one of the major differences, so first of all, ABA is based completely on the principles of operant conditioning, that we can change behavior by changing what happens before and what happens after a behavior. So ABA is all about building skills with that principle. I can teach this child how to do this new behavior or have this new skill by changing their environment in a way that will more likely elicit the behavior, and by reinforcing them for doing this behavior, helping them. And when I say changing their environment, I also mean, for example, giving them prompts. We add a prompt into the environment to help to make this behavior more likely to happen. Play therapy is generally used in the mental health sense. ABA should be play-based for young kids. Young kids who are getting ABA should be learning through play. But the therapy that's specifically called play therapy is generally, at least from my knowledge, is a type of mental health counseling intervention, or it's a type of mental health counseling or an approach to it. And so we would be using play therapy. If you were getting play therapy, it would not necessarily be for identifying areas of skill delay or language delay or things like that. Although I suppose those things could be incorporated into it, but the main purpose of play therapy would be to address mental health issues that a child is facing, like anxiety or depression or a trauma history or stuff like that. Speech therapy is the focus of speech therapy is speech and language. Speech therapy is generally far less intensive than ABA. A child might go to speech therapy every week or maybe twice a week, and a child is usually getting ABA, or at least young kids are getting ABA every day or almost every day. So ABA is usually a lot more intensive. ABA would work on lots of different skills and lots of different domains of functioning. So yes, ABA would most likely be targeting goals related to speech and language, but ABA would also be targeting play skills, group skills, imitation skills, motor skills. So lots of different areas of functioning based on where the child is showing delays or where the child is behind their peers. And I can't really speak to the types of interventions that a speech therapist would use because I am not a speech therapist and don't have expertise in that area. So I don't know how speech therapy interventions would be different than ABA interventions. Will ABA work for late diagnosed adult with personal hygiene and space cleaning issues. Yes, ABA could be effective for that. ABA can, like I said, you can use ABA to teach any behavior, to teach any set of skills. And so certainly ABA could be effective in teaching an adult how to take care of their body, how to keep their living space clean, or how to take care of it. And in doing so, the person providing ABA would again need to look at two things to get started. Number one, does this person have the skills to maintain their personal hygiene and to maintain their living space? And if not, we need to teach them those skills. And two, does the person get reinforcement for doing those things? Is it motivating? Does the person not have the motivation to do those things? And if not, how can we set up a living arrangement or a routine, or what happens in their everyday life, so that doing so will help them access reinforcement of some kind? Reinforcement does not necessarily need to be, you get this prize when you do your work. It can be, I mean, sometimes it is that, but it could also be, we're going to set up a schedule for you so that doing these things is more reinforcing, in that once you get this done, you get to move on to a more preferred activity. So we're going to put your iPad time after your shower time in your schedule, so that once you're showered, you get to do this thing that you want. So it is not necessarily, just finding something external that we can give this person so that they're willing to do non-preferred tasks like taking a shower or cleaning their house. It's also, how do we set up their environment and their routine and their life so that doing these things is easier and more reinforcing? So certainly ABA can be effective for an adult who is needing help with these types of skills, with these behaviors. Now, the challenge would probably be finding a ABA provider who works with adults, because unfortunately many of them will work only with children. Can ABA be used to teach a child to write? Yes, ABA, again, can be used to teach anyone anything. It is simply, well, not anything, but any behavior. You can use ABA to teach that behavior. So if you were going to use ABA to teach a child to write, you would again look at where they are and what are the most basic foundational steps to writing that this child needs to learn at this time. So if the child has, can't even hold a pencil, we need to start there. If a child will hold a pencil and scribble, then maybe we need to start with making more, what's the word I'm looking for? Making more deliberate lines or circles or shapes with that pencil. And we would start there with those very small steps and gradually do more and more, each step along the way, providing the reinforcement. Okay, if I make a straight line, I get reinforcement. Making the straight line is valuable. Now, and so I'm going to do it. Once he's making the straight lines every time we need him to, or in 80% of the opportunities, then we move on to what's next. So I made, what was getting me reinforcement is not anymore. Now I need to do a little bit more to get reinforcement. And it's a very gradual process so that what has already been learned doesn't get lost once we increase the requirements, but always providing lots of opportunity for reinforcement. Now, I will say that that kids with autism often have some fine motor challenges, and so a lot of kids see an occupational therapist for help with fine motor challenges, and fine motor challenges can make it really difficult to write and really hard for a child to have to sit and do that. Can make it, feel like they are not being successful because of the challenges with their fine motor skills. So do take that into consideration if you're trying to teach a child how to write. Also, people with autism tend to be diagnosed with dysgraphia at higher rates. Dysgraphia is challenges with writing, like specific learning challenges that have to do with the physical act of writing. So that it's certainly not everyone with autism has dysgraphia or fine motor challenges, but do be aware that those challenges are pretty common in the autism population, which can make writing much more difficult, much harder to do, much more labor intensive, cause much more frustration. So, and if that is the case, if there are fine motor challenges, ABA is not going to address those fine motor challenges. ABA may be able to help the child learn the skills to write, but that child is still going to have, it's still going to be hard for that child to write because of those challenges. So ABA can help to build the skill, but it's not going to address, the physical challenges or the things that are beyond just simply the behavior, doing the behavior itself. Okay, I am just about out of time, so let me remind everyone that the Johnson Center's YouTube channel has all of our old, previously recorded webinars available for you to view at any time. You can follow the Johnson Center on Facebook, Twitter, Instagram, sign up for our email notifications, and please contact the Johnson Center for any, if we offer any services that might be of help to you. Thank you so much for your time and attention. I apologize if I did not get to all of your questions, but we'll keep any that I have left hopefully for future Q&A webinars. Thank you so much.